Good morning to Lazar Manuel, who supports us from the studio, to the sign language interpreter, and most important, to all people who listen to us every morning. With your permission, I will remove the face mask, considering the social distancing we keep in the studio. Today is not a good day for our country. Unfortunately, we'll begin the conference by conveying our condolences to the relatives and friends of an 84-year-old patient from Havana, the Este Octubre municipality, who showed the first symptoms last July 25th, mainly a feverish syndrome, which led to be hospitalized on July 30th. He presented a rather torpid evolution while admitted at the hospital. At the ICU, a PCR was applied, considering that a feverish syndrome is also a symptom for COVID-19. He tested positive, but a series of complications made impossible reviving the patient after a cardiac arrest. I repeat, we start the day with this unpleasant news and extend our condolences to his relatives and friends. All right, we have 463 COVID patients admitted to our hospitals, 18 under medical supervision, 216 are suspects, and 229 are confirmed active cases, a high figure of current active cases. In our primary healthcare system, our professionals and specialists follow up 6,467 and have been asked about this increasing figure. The fact is that this includes discharged people for the disease after being 10 days hospitalized. After the PCR has been negative, we still keep them 14 more days quarantined at home under medical supervision. But this does not explain such a high figure. However, every time there's a new focus of transmission, the restriction measures are applied, which embraces thousands of people, for example in Bauta, Baracoa, where people are under constant supervision to detect the emergence of any COVID-19 related symptoms. Hence, the higher the figure of confirmed cases in our country, the tougher the restriction and isolation measures in some areas. At the molecular biology laboratories, more than 3,000 samples were processed, 3,389 to be more precise. At the Tropical Medicine Institute Pedro Coury, 1,521. At the Provincial Center of Hygiene, Epidemiology and Microbiology of Havana, 751. At Santiago de Cubas, 282. At Villa Claras, 250. At the Genetic Engineering and Biotechnology Center, 370. At Hermanos Samejeiras Hospital, 130. And at the Laboratory of the Civil Defense, 85. As a result of these 3,389 studied samples, 31 people tested positive for COVID-19 and SARS-CoV-2. Thus, we accumulate 277,863 processed samples in our country, and 2,701, which represents the 0.97% of all analyzed samples. Yesterday, other provinces also processed samples. In Artemisa province, and we are aware of the epidemiological situation, 319 samples were studied. In Havana province, as usual, a higher number, 2,407, in Cienfuegos 70, in Ciego de Ávila 67, in Santiago de Cuba 97, and so forth in every Cuban province, according to the complexity and the emergence of new cases. The 31 people diagnosed yesterday are Cuban. 17 of them are confirmed case contacts for a cumulative of 2,299 people, the 86.5% that have been confirmed case contacts, represent in this way a high-risk group for COVID-19. However, most of the time we didn't know they were positive until the test confirmed it. Sometimes people are not quite comfortable with our measures, but every time we report a confirmed case, the alleged contacts are isolated, hospitalized, studied, and properly treated in order to stop the transmission chain. Of the 31 new patients confirmed yesterday, the source of infection of 4 of them is yet to be determined, for a cumulative of 132, a 4.9% of all positive cases whose source of infection is yet to be determined. Of the 31, 10 have their source of infection abroad, what amounts to 227, and 8.5% of all diagnosed cases in Cuba. 19 are male for the 50.2% of all diagnosed patients in Cuba, and 12 are female, 49.7%. 21 of the new cases are asymptomatic, another risk of the disease for a cumulative of 1,501. The 55.6% of all confirmed cases in Cuba did not present any symptoms at the moment of the test. And as to answer some questions, there could be patients who may not show any symptoms during the illness period, as well as patients whose symptoms are developed during the hospital admission, which permits an early detection of the virus and the continuation of the treatment. Of the 31 new cases, 13 cases, the majority, are placed in the 40 to 59 age group, 10 cases in the 20 to 39 age group, 7 cases exceed 60 years of age, and 1 case under the age of 20. A 10-year-old boy from Artemisa province, which amounts to 308 individuals under the age of 20 in our country, of which a 91.2% are discharged, recovered, and those who are hospitalized at the moment present a clinically stable evolution. Of the 31 positive cases, 17 belong to Havana province, 3 of them imported cases, that is to say that 14 are local transmission cases. Artemisa province has 7 diagnosed patients, 1 of them being an imported case, 5 from Bauta, 1 from Artemisa, and 1 from El Mariel. The Artemisa patient represents the imported case. In Pinar del Rio province, there are 2 cases. 1 of them is imported, and the other one from Pinar del Rio municipality, which affects the incidence rate. Holguín diagnosed 2 cases yesterday, both of them imported. Santi Espíritu, Ciego de Ávila, and Granma provinces confirmed 1 case each, also imported. Concerning each municipality, the local transmission cases, not the imported ones, inasmuch they arrive to the country and are immediately taken to an isolation center, they don't have any contact with the rest of the population. Hence, they are not considered a territorial incidence. They come infected, and such diagnosis is provided in our country once they are admitted to the isolation center. This gives place to another question we've been asked. Why do these patients provide a certain number of contacts if they follow such strict measures in their way to the isolation unit? Well, it's valid to remember that they travel with several people in the airplane and are also isolated with more people despite these restriction measures applied. Also, they're transported in a vehicle with a certain amount of people, which at the end are all contacts that need to be followed and studied. Of the local transmission cases, and this is another information required by our population, 14 belong to Havana province, from the municipalities of La Lisa, Marianao, Playa, 10 de Octubre, Habana del Este, Cerro, and Plaza de la Revolución. So these are the local transmission cases from Havana. In Artemisa province, we have 6 local transmission cases, 5 from Bauta and 1 from Mariel. And from Pinar del Rio province, there's 1 local case from the same municipality. With this behavior, until yesterday, the incidence rate per 100,000 inhabitants in our country increases from 1.65 to 1.84%. Artemisa province has the highest rate of infection, with 17.67%, which has rises compared to the day before. Havana follows with a rate of 4.78%, also higher than the day before due to the local transmission cases. Then Villa Clara with 0.39%, same as the day before, since there are no new cases. Pinar del Rio, that reported 1 local case for the first time, has an incidence rate of 0.17%. Thus, of the 2,071 patients diagnosed with the disease in Cuba, 229 are hospitalized active cases, an 8.4%, a high figure compared to previous results. Of these 229 cases, 228, a 99.5%, present a clinically stable evolution. The deceased person we reported today amounts 88 fatalities in our country, for a mortality rate of 3.26%, which compared to the regional rate of 3.74% and a global rate of 3.81%, places Cuba in the 21st position in the Americas and the 113th in the world. We always mention the 2 evacuated patients at the beginning of the pandemic. Yesterday, 9 patients were discharged, 6 from Havana, 2 from Artemisa, and 1 from Cienfuegos, for a cumulative of 2,382 recovered people and 88.3%. The patient we had been following as a critical but stable from Havana province, who is hospitalized at Dr. Luis Diaz Soto Military Hospital, presented a favorable evolution yesterday and today is reported in serious conditions. For the global outlook, as we will address now, there's not too much control on the situation. Up to last night at 12 o'clock, the same 185 countries remain to diagnose COVID-19 cases, with 214,641 new cases reported yesterday, and the total amount exceeds the 18,056,310 worldwide confirmed cases. 3,938 people died yesterday, for a cumulative of 689,219 fatalities due to the disease and a mortality rate of 3.81%. The region of the Americas continues to be the epicenter of the disease, with the most affected countries inasmuch of the 18 million worldwide cases, 9,762,672 belong to the Americas region, which is a 54.06% of all global cases. Yesterday, 111,200 people were diagnosed with the COVID-19. There were 2,089 deaths for a cumulative of 365,388 fatalities, for a mortality rate of 4.74%. Lilia will help us show a chart created with the support of the Monitoring Center staff that shows the countries with more fatalities for coronavirus. I will present this to all of you so you can be certain that this disease is actually killing people. We have the United States of America as the country with more fatalities so far, with 154,860 deaths. Brazil follows with 94,104. Mexico, not similar in extension as Brazil and the United States, but occupies the third position with 47,746 deaths. The United Kingdom with 46,119. India, 38,135. Italy 35,154, and so forth. France, Spain, Peru, also with 19,614 deaths, and Colombia with 10,650, as well as Chile with 9,608. I make reference to these countries of the Americas region that are included in the list of countries with more fatalities for coronavirus. These figures are absolute numbers, not the mortality rates as such. I appreciate the support provided by the staff of the Monitoring Center and the effort to show everyone that this is not a simple flu. As I have heard some people say, that's just a flu. That's not correct at all, since it presents a mortality rate 4 times higher than any influenza-like illness. This is all the information we can provide, which, as I have said, is not a favorable situation. However, this encourages us to work harder in our communities.